I heard you say we have a new premier. Was that supposed to indicate that everything's going to be okay now? Or is this during politics?
No, I was just saying that there's a lot more.
There isn't anything that you can say or that you can do that's going to change anything. You ask the people here that ask you a question, you're not going to change a thing. Because it's not a healthcare system for the healthcare. It's a profit system for making money. And the pharmaceuticals are making billions feeding our seniors pills that they should never take. I have a friend, his mother was in that Capilano on the Gretzky Freeway, and his mother was in there. She wasn't being fed well, and she was in a dark room, and he went in there, and I was with him, and he wanted to move her, and she barred him. She said, "You get out of here and don't come back, and if you do, I'm going to call the police on you." That's what happened. You're not going to stop that. There's too many people making big money on this thing. They're not worried about the patients and the seniors. I was also in the Glenrose, and when you're in the Glenrose, and if you didn't take the place they told you to go, you had no say at all, none. You had to go where they told you. Was that for some doctor that had an interest in it, or what was happening there? How come the patient couldn't decide whether you at least have a say where they're going to go? You're barking up the wrong tree. You're not going to do any good here at all. It's just only for window dressing. And I've lived too long to see it any different. But good luck.
Thank you for your comments. And no, and I genuinely mean that, because I think what Isabel and I have, as we said at the beginning, we're very humbled by this whole work that we've been asked to do, because we're going to do our best to try to be a collective voice, to take the messages that you give us today and that we've heard from the 900 people. Are we going to be able to change it overnight? Likely not. But we're willing to listen. We're willing to get your feedback. And I think what you're saying is that, you know what, let's not make it complicated. Let's not make it political. Let's do the right thing, because it's the right thing to do in the name of patient care and good patient care. And we can learn a lot about things that we wished had not happened. And we need to change and learn.
But he was kicked out of there and he couldn't go to see his own mother. What kind of a system is that? Can you tell me that? Maybe you can answer them.
Yeah, I mean, I can't speak to the specific
Well,
circumstances, but you know what? We need to focus on person-centered care, and that means families, the resident, all those people that surround him.
They kicked him out. Kicked him out.